everyone. Today we'll continue in the second session of the lipid module. So we talked 2 weeks ago about lipid metabolism. What is the lipid? We talked it's a triglyceride, the main component of lipid, which means like glycerol attached to 3 fatty acids. And we talked about different types of fatty acid, like saturated fatty acid, trans fatty acid that are unhealthy, and the unsaturated fatty acids, more healthy, and today we'll see why. We talked also about the digestions and absorption of lipids. And for example, we talk about how the bile be synthesized in the liver and will be secreted and play an important role in emulsifying because it contains mainly phospholipid, and the bile contain a large amount of cholesterol as well. And also we talk about the lipoprotein, the carrier of lipid in the blood. Mainly we talk about, for example, when we digest food, the main lipoprotein circulated in the blood is chylomicron. Right? When we have fat in the food, the main one is chylomicron, and how lipoprotein lipase in the blood act on the chylomicron to break down the triglyceride content of the chylomicron to release the fat to the organs. And same things when we're not eating, this is how lipoprotein lipase act on the chylomicron. Then between meals, we have the liver produce VLDL as a source of fat to be when we don't have food. And we saw how the VLDL like LPL also break down the VLDL to have IDL, then further LDL, and we talked about the LDL. We call it the bad cholesterol, and today we'll see why, and should be cleared in the body, and that happened by the liver, and there is here something called the LDL receptors on the liver to clear out the LDL. We saw that there is also a healthy lipoprotein called the HDL, which also play an important role in clear the LDL inside the cells, and we talked about one example about the vessels, like cells, so how the HDL clear the cholesterol because high level of LDL will accumulate, and today we'll see the details. This is different types of blood work, we can say, that all are biomarkers of cardiovascular disease. So if increase the LDL, the triglyceride, and also we have additional measures like the total cholesterol to HDL ratio. When it's increase the risk of cardiovascular disease. Then we talked about different function of lipids, especially here omega-3 and omega-6 that produce eicosanoids, especially omega-3 has eicosanoid playing an important role in suppress inflammation. This is important. And this is beta oxidation, and here we talk when we don't have carbs, the fat produce ketone bodies, and we reached here this point. We'll talk here about when we eating, we store fat, right? We store the energy in type of fat, and this is happen or regulated by the hormone insulin. So when we digest the food, because of the presence of carbohydrate, the insulin level will increase in our body. That regulate the uptake of the fat from the chylomicron mainly because the source of fat from food, and the LDL also, that insulin activate the lipoprotein lipase to break down the fat from the chylomicron in order for the adipose tissue, when we store the fat or the excess energy, be able to uptake the fat and store it. This is when we are eating, after we eat the meal, that happens. Now, between meals, when we are not eating, when we're fasting, the level of insulin will go down. Other hormone called hormone-sensitive lipase would go up because when there is insulin, when we eat, the insulin suppress the hormone-sensitive lipase. But when there is no insulin, the hormone-sensitive lipase will be high, and the hormone-sensitive lipase important to restore the stored energy in the adipose tissue, because the body is, when we're not eating, we need energy. So the lipoprotein lipase break down the triglyceride. As I mentioned, it's fatty acid attached to glycerol, which is the main lipid, break down the triglyceride in the adipose tissue to release the free fatty acids as a source of energy. Clear? So the free fatty acid here, because they are smaller molecules than the big triglyceride, they don't need the lipoprotein carriers in the blood. They need smaller one called albumin. It's a type of protein that carries the free fatty acid in the blood to produce energy when we are not eating or fasting or between meals. Any question? Okay. This figure is similar to what I'm saying. So here we repeat, postprandial meal when we eat after meal. First things what happen, the blood glucose will raise. In response to that, the insulin will be secreted, with the goal is to normalize the blood glucose to a normal level. Okay, so to do that, what happened, the insulin, as I mentioned, suppress the hormone-sensitive lipase, which means we do not want energy from when we store from adipose tissue, so suppress the free fatty acid release or the fat release. And at the same time, it increases the insulin, the lipoprotein lipase. The lipoprotein lipase break down the fat from the chylomicron, from the food that we have, to release the fat to be stored in the adipose tissue. Clear? So when we eating, the main source of energy is the glucose. At the same time, the insulin, since suppress the fat release, or activate the storage of the fat in the adipose tissue. For the muscle here, the muscle will uptake the glucose, because when we eat, as I mentioned, the glucose is the main source of energy, and they do not rely on fat. The liver also will take the glucose in the blood and store it as glycogen, so increase the glycogen synthesis, and the adipose tissue as well take the glucose to produce glycerol, which is the backbone of triglyceride. So that's all, this whole process achieved the goal of insulin of normalize the blood glucose. Clear? Any question? Okay. Now, between meal, yes, do you have question? Yes, please. Okay. The muscle do not rely on free fat because not exist. Insulin shut down that process, and the main source of energy when we eat is the glucose. So the favor of muscles for energy, because the big tissue for our energy will take the glucose. Now when we're not eating, when we are fasting, there is no high blood glucose in our body, so no need the insulin to be secreted. There is low insulin. When we said when there is no insulin, the other hormone, which is hormone-sensitive lipase, will be activated. And this time, why? To restore the stored energy in the adipose tissue. So what happened, the hormone here in the down one, the hormone-sensitive lipase increased, that increased the adipose tissue releasing of free fatty acid. And now we come to your question. Now when the free fatty acid is available in the blood, will be more favorable now for the muscles to take free fatty acid as a source of energy, and they do not rely now on glucose because we're not eating. Same thing for the muscles. So the muscles take the free fatty acid as source of energy because we are not eating, and they do not rely on glucose to maintain normal blood level in glucose. We don't need to deplete the glucose for the brain. Same things does the liver of producing glucose through process called gluconeogenesis. Gluco means glucose, new genesis like generate. So, and to keep a normal blood glucose. So in this case, we have the main source of energy is the free fatty acid or the fat. Clear? Any question? Yes, please. Exactly. So what regulates all that is the insulin, the hormone insulin, and the hormone-sensitive lipase.
Yeah, but I just wanted to clarify, like throughout the body, the main source of energy during fed would be glucose.
Yes.
The main source of energy during
Fasting is the fat. Right. So now we'll continue, and I will talk about the fat effect of the fats. So we'll talk about the health effects, of dietary fat. We'll talk about atherosclerosis. Atherosclerosis is a condition that damages the arteries, the blood vessels, and cause very serious issues, and we call it cardiovascular disease. So if you can see here how the process that happened, if you can see in the first one, this is the normal arteries or blood vessels, and when an injury happened to the wall of these arteries, and the reason why the injury happened, it's first, main reason is the high blood pressure, and there is other different risk factor. We'll talk about them later. So when we have this injury, and this injury, when we have high LDL level in the blood, the LDL level will slip into the artery wall. When the LDL slip in the artery wall, being oxidized, like reaction with oxygen, and we have something called oxidized LDL. This oxidized LDL will be treated as a foreign body in our body, like the immune system will be stimulated, something wrong in here, and as you see here, the white blood cells will stick into the artery wall and migrate inside the artery wall. These white blood cells called macrophage. This macrophage is a type of white blood cells that engulf the foreign substances, like eat them, like the Pac-Man game. Okay, so to get rid of this combination of the macrophage and oxidized LDL called foam cells. Why foam cells? Because under the microscope, it looks like the sea foam. Now this combination, or we call it the foam cells, which is white blood cells and oxidized LDL, these cells, the foam cells will die or ruptured. Because of that, will form something called fatty streak, which means like dead cells and the deposit of oxidized LDL. Clear? So now we have the fatty streak, which is dead cells. Those dead cells call for reinforcement, those white blood cells that dead, call for reinforcement, so stimulate the immune system. They secrete like substances. Those substances, we call them pro-inflammatory substances, or here we can say inflammation process. And remember, the atherosclerosis is an inflammatory condition. Okay, but of course the LDL play an important role. So they call for additional white blood cells to come and help them in the fatty streak, because the white blood cells here are dead. So it's like a cycle. More white blood cells would come. They will die with the they take the LDL, oxidized LDL, and they will die and create fatty streak, and this fatty streak will become larger and larger and larger, and here we can see they form something called a plaque. Clear? Now, if you can see in this figure, the artery become narrow. So the narrowing will cause less blood supply, less oxygen, less nutrient. For example, if it's in the heart, the individual will suffer from symptoms like chest pain. Clear? Because of the inflammation continue and more white blood cells will come, the plaque will continue growing. And also the muscle cells from the artery wall will go and migrate inside or above the plaque and form something called a fibrous cup. This fibrous cap is like a shield to protect the plaque from the inner environment of the blood vessels, because it contains very dangerous substances that make We call it coagulant that make blood clot. Why? Why? Because with the more inflammation, the fibrous cap were ruptured. And in this moment, the blood clot happened. As a result of that, a complete block off of the blood vessels, which result in heart attack if it's in the heart, the vessel, or if it's in the brain, resulted of a stroke. And the heart attack in the heart, we call it myocardial infarction. Any question? I try to be slow just to clear. Okay, so now if we have time, let me see if we can play the video here, if it works. You don't have to, just this is okay.
This is the story of how too much cholesterol in the body can set up a process that spirals out of control and could cause a heart attack. Cholesterol is a useful lipid that the body needs to control digestion, make steroids, and maintain healthy cell membranes. Cholesterol is carried through the bloodstream in particles called LDL. Everyone needs cholesterol in the proper amounts. But if there is excess LDL in the bloodstream, it pushes inside the artery wall and accumulates where it doesn't belong. The body interprets this as an invasion that touches off a natural inflammatory process to try to limit the infection. Inflammatory cells are called into action, literally swallowing the invading LDL until they form a lipid core inside the artery wall. Now, it's crucial to keep this lipid core away from the blood because the core has a strong clotting agent. The inflammatory process sets up a protective barrier by forming a cap made of a tough, fibrous matrix, and for the time being at least, the fibrous cap is strong enough to keep the plaque separate from the blood. But eventually, the inflammation breaks down and weakens the fibrous cap that was the last line of defense between the clot-causing lipid core and the circulating blood. This lesion has now reached its most dangerous state. And in this vulnerable state, the plaque is an accident waiting to happen. Any one of the many typical daily stressors that are normally harmless could be the last straw for a vulnerable plaque, triggering a rupture in the cap. With a cap rupture, there's nothing left to prevent the mixing of the plaque's clotting agent with the blood. The likely result is a clot in the artery. Now, the extent of clot formation and the damage it may cause could range from minor to fatal. The most unfortunate ending of that vulnerable plaque story would be a large occlusive thrombus that causes the heart muscle tissue to die from lack of oxygen. If too much tissue dies, the entire heart can stop working, suddenly killing the patient.
Okay. It's just similar to what I'm saying. Okay. Any question before moving forward? So, because we have short of time, so please stop me when you have anything. Now we will see the effect of dietary. Now we saw that LDL is a risk factor for we call it cardiovascular disease and atherosclerosis, correct? There is different types of dietary fat from what we ingest that affect the LDL level in our blood. So we have first the saturated fat, as we mentioned in the last section, that it's called unhealthy. And why that it's unhealthy? Because it decreases the LDL receptors on the liver surface, which means less clearance of LDL in the blood that will result with raise of LDL cholesterol. For the trans fatty acid is worse than the saturated fat because they do increase the LDL cholesterol and also decrease the HDL cholesterol, which is the good cholesterol that clears the excess cholesterol from the cells. And why that happened? The trans fatty acid increase the cholesterol synthesis in the liver, so produce more cholesterol. Clear? Okay. So the different types of fatty acid that have in our food is the polyunsaturated fatty acid. Those, in general, the unsaturated fatty acids are healthy because they reduce the LDL cholesterol level. So we have different type of polyunsaturated fatty acid. The first one is the omega-6. The omega-6 increase the LDL receptors in the liver surface, which means more clearance of LDL from the blood, that will result in decrease of LDL cholesterol. Same things, the omega-6 fatty acid increase the bile synthesis in the liver, which means when we have more bile synthesis, which means stimulate the liver to take cholesterol from the blood to synthesize the bile, which we need it when we digest the fat. So when the fatty acid, omega-6 fatty acid increase or stimulate the liver to produce more or synthesize more bile, that will result in reducing the LDL cholesterol in the blood. There is a very weak effect of omega-6 on HDL cholesterol, but it's not significant. The other type of fatty acid is the omega-3 fatty acids. The omega-3 fatty acids actually increase the fatty acid oxidation, mean destroyed the fatty acid for energy in the liver. So the liver doesn't have enough fat to produce VLDL. You know, as I mentioned before, when we're not eating, the liver produces VLDL as a source of fat as energy in our body. So when we ingest omega-3 fatty acid, the omega-3 increase the fatty acid oxidation in the liver, which means deplete the fatty content in the liver, which resulted in reduce the VLDL synthesis, which result in less VLDL in the blood, and also increase the VLDL uptake from the adipose tissue. This all here in the green, they are all resulted with less VLDL. We didn't talk about the effect of VLDL on heart disease. We talked about LDL cholesterol, but there is different mechanism that the VLDL cholesterol increase the cardiovascular disease. So this is beneficial of reducing the VLDL cholesterol, which mainly it's a triglyceride. Clear? Yes, please. Yes, LDL, as I show you in this beginning of this lecture as well, they are on the surface of the liver. So when we have LDL in the blood, they will be cleared in the liver. But how the liver will clear them, there is a receptors on the surface of liver to take the LDL. So this type of fatty acid, especially here we're talking about the omega-6 fatty acid, increase the number of those receptors. So the liver can clear more LDL from the blood, that will reduce the LDL. The last type is here in the red is the monounsaturated fatty acid, which is rich in olive oil and avocado. This type of fatty acid decrease the LDL oxidation, and we saw that LDL oxidation is an important of developing the atherosclerosis, right? So in this case, this is helpful, and there is other mechanism that the monounsaturated fatty acid decrease the LDL cholesterol in the blood. I'm not going to explain the mechanism that's as a mechanism, but the others are important. Clear? Okay, sorry, I hear a lot of voice from back, so that interrupts for others, so please. So for that reason, the dietary recommendation is to replace from Canada's Food Guide, that replace food high in, or actually consume food high in unsaturated fatty acid to replace the food high in saturated fatty acid. And that makes sense now, right? And why this replacement? What is the evidence behind this one? If we look here, first, this study see the effect of different types of fat on cardiovascular disease risk, and how they measure the cardiovascular disease through the ratio. I mentioned the ratio of total cholesterol to HDL cholesterol. When it's high in the blood, when they measure it, it's increased the risk of cardiovascular disease. So this is what they are looking. So if you look on number one represent here is the amount of fat in typical American diet. this is what usual population in US eat as a fat. If we go to number 2, when they replace a fixed amount, the same amount, for example, of the fat they eat, by margarine, the stick one, the hard one, which is it contains the hydrogenated fatty acid and contains trans fatty acid. This is not available in Canada anymore, which is good, as I mentioned last time. And also when they replace the fixed amount of their diet by margarine, the stick, the butter, and shortening, which are rich in saturated fatty acid, the ratio of total cholesterol to HDL increase, which means increase the risk of cardiovascular disease. Clear? Now, if we move to number 3, when they replace a fixed amount of the fat they consume in their typical diet by different type of fat, which is here the margarine in the top, mean the soft one, which is available here in Canada and rich in unsaturated fatty acid, and different vegetable oils like olive and soybean canola, they saw that the ratio of total cholesterol to HDL decreased, which means decrease the risk of cardiovascular disease. So for that reason, the recommendation is always replace. Clear? Now, the relationship between saturated fatty acid that increase the risk of cardiovascular disease is well established in the late 50s. But recently, there is a lot of going on, or studies, they said that we are blaming saturated fat, that cause, the saturated fat mean the solid one, okay, like butter, beef tallow, etc. So we blame them for increase the risk of cardiovascular disease, but there is debate of that. But these studies that doubt the relationship, they do not consider the replacement. I will explain more. So here in this data, or this study, we saw or measured the risk in cardiovascular disease. Before I explain, here the graph, if you can see in the bottom, this is the change of, or the risk of cardiovascular disease. And the positive mean increase the risk, and the negative mean decrease the risk. And those bars in black are something called confidence interval. Those when it's cross or it contains 0, that means is not significant. That means there is no difference. Okay, now I will explain. Okay, so when they saw that in the when the population, group of people, when they replace their typical, the fat content of their typical diet, the American diet, when they replace it by the trans fatty acids, the cardiovascular disease risk increase here, if you can see in red. Although it's not significant, which means not very different, but this is logical because we know that the trans fatty acid increase the risk of cardiovascular disease, correct? So there is no something new. When we consume trans fatty acid, the risk of cardiovascular disease here increased, right? Which is logical, no. Say different group of individuals, when they cut down or cut off the saturated fat and replace it same amount, they eat carbohydrate from refined sources like white bread, added sugar cereals, etc. They saw that the cardiovascular disease risk is not significant. There is no change. This is in red, the second one in red. So there is no change in cardiovascular disease. So they said, see the saturated fatty acid, if we cut down the saturated fatty acid or cut off, we will not see any benefit for cardiovascular disease. But this is actually not quite right. Why? Because what they did, these individuals or population, they replaced the saturated fat by something unhealthy, which is refined carbohydrates. Clear? But when we saw data from different population, when they replace the saturated fat, they cut down the saturated fat or cut off and replace it by unsaturated fat, especially here if you can see PUFA, the cardiovascular disease risk decreased by 25%. And even if they eat carbohydrate from whole grain, which is good sources, also the cardiovascular disease risk decreased. So the key in the recommendations is the replacement. That's why Canada's Food Guide, they recommend the replace of saturated fatty acid by unsaturated fatty acid, not only cut off and eat something unhealthy. Okay, any question? Clear. In this graph here, we are seeing different types of, we call it risk factors that affect different types of chronic diseases. We saw here in the bottom, we see that low PUFA in place of saturated fat, which means diet high in saturated fatty acid, it's a risk factor, increase the risk of cardiovascular disease. Here in the black, the black part of the bars are cardiovascular disease, what we are talking about now. So if you can see at the bottom that saturated fatty acid actually is increase the risk, is a risk factor for cardiovascular disease, but it's only a small amount. If you see different risk factors, especially in the dietary one, those in red, we saw, for example, low intake of fruit and vegetables increase the risk of cardiovascular disease more than saturated fat, diet high in saturated fat. Same things for example, sodium. Diet high in sodium, in salt, it's increased the risk because sodium increased the blood pressure. And we saw that the blood pressure, it's very important that make the injury the first step in atherosclerosis that damage the blood vessels, right? So different risk factors, they play important role. Like, for example, diet, which is low in omega-3 fatty acid or low in seafood, increase the risk of cardiovascular disease. And can someone know why the omega-3? We saw that omega-3 that decreased the VLDL, one of the mechanisms. The other mechanism, the omega-3 is antioxidant. So, or not antioxidant, sorry, suppress inflammation, which means suppress the inflammation cascade or process for atherosclerosis. Yes, please. Alone, yeah. So this risk factor alone will decrease the risk of cardiovascular disease. So if only saturated fat, but if you eat like fruit and or diet low in fruit and vegetables, increase the risk more and more. So it's not only one risk factor, it's combination. And now we'll talk about the diet, the whole diet, not only one type. No, so here, each bar alone represent one single effect of risk factors, okay? So if we here, this one, low PUFA in place of saturated fat or diet high in saturated fat alone, increase the risk by this type, this amount. Low fruit and vegetable, this amount. If you can see here, the top of those risk factor is smoking. So, right, smoking is very increased risk of cardiovascular. So it's good things someone smoke to cut off the smoking to protect themselves from cardiovascular disease. Any other question? Yes, please. Sure, yeah. First things here, let's go here. We saw that omega-3 fatty acid decrease the VLDL. VLDL cholesterol, you don't have to know the mechanism, but it's risk factor of cardiovascular disease. We know the mechanism of LDL cholesterol, how affect the artery, etc. But VLDL also itself. This is first. The other one, let's go back also in the lectures. If you go here to eicosanoid, we can see that the omega-3 fatty acid, it increased the synthesis of eicosanoid. The role of those eicosanoids suppress inflammation. So why inflammation is important? Because here, as I mentioned, in formation of atherosclerosis is inflammatory things, right? The more inflammation, which means more dead white blood cells, the more stimulation of immune system, the cycle of the inflammation increase. The more inflammation in the body, the more progression of atherosclerosis. The plaque will increase, the fibrous cap here will rupture. So this is all because of inflammation. So omega-3 suppress inflammation, which is help in this issue. Clear? Yes, we'll Oh, good. Still have 15 minutes. Please stop me if you have any question, because I might, this should be in 2 hours, but unfortunately you have exam last week, so we did it in 1 hour. Okay, so now we talk about different type, as one of your colleagues asked me, like alone saturated fat effect. Someone will say, okay, we talked about saturated fat increase the risk of cardiovascular disease because saturated fat increase the LDL, as we saw before. How about the dietary cholesterol, the ready cholesterol that exists ready in food? Actually, the effect of dietary cholesterol that raises LDL is not quite high effect. The saturated fatty acid from food, it's way more have effect on increase the LDL cholesterol than the dietary cholesterol, okay? And coincidentally, or it happened that, anyways, the dietary cholesterol, as I mentioned in the first session, if you remember, it's only from animal sources. And those animal sources are the sources of saturated fat, which means they are always the food that has saturated fat, like, for example, beef tallow, whatever, like fatty meat. Those has also dietary cholesterol, so they come together. So when you reduce the saturated fat, you technically reduce the consumption of dietary cholesterol, except for one type of food, which is egg. The eggs are low in saturated fatty acid, especially egg, the yolk here, egg yolk, and high in cholesterol. So a lot of studies they did if the egg we should eat because will increase LDL or not, and they found, a lot of studies of course they did, from cohort, like cohort study, right? They follow for a long period of time. They saw there is no change in cardiovascular disease. Similar things for randomized controlled trials. So they generally recommend like 1 egg per day will not affect the risk of cardiovascular disease. And egg is good source for protein, and it's very nutritive food. Clear? Perfect. Now we'll move to other type of food is the fish. Fish is a source of omega-3, and here I explain 2 reasons why omega-3 is important for cardiovascular disease, and your professor required reading for your assignment or something like that, so keep in mind those pages. I guess you have them in the slides. Now, remember also back to your question, you asked me about saturated fat, and then I said saturated fat alone, fruit and vegetables also. So not only one type of nutrient or one type of food will affect the health. It's the whole food we eat, so the whole food choices. That's what we call it dietary pattern. So dietary pattern means the selection of all food combined that we consume. So there is a lot of or number of healthy dietary pattern that associated with low risk of cardiovascular disease. One of them, well-known, is the Mediterranean diet. You know Mediterranean diet, right? From one of previous lecture, I guess. So the Mediterranean diet, it's the diet for those countries in the Mediterranean region, and it's high in olive oil, in fruits, vegetables, and less in red meat, etc. So large number of studies. They did maybe the most dietary pattern they've been studied in nutrition science, and they all been consistent from randomized control trial or mainly from cohort study that decrease the risk of cardiovascular disease. So it's very healthy dietary pattern. This is one. The other type of dietary pattern, it's called the DASH dietary pattern. DASH stands for dietary approaches to stop hypertension. So it's mainly for lower blood pressure. Hypertension means high blood pressure. So dietary approaches to stop hypertension is other type of healthy dietary pattern. Is also recommend the consumption of fruit, vegetables, very similar to Mediterranean diet, but the only difference is the amount of dairy. Why? Because the DASH diet recommend to consume food low in sodium, because sodium increases the blood pressure, high in potassium, magnesium, and calcium, because those nutrients, potassium, magnesium, and calcium, control the blood pressure and lower the blood pressure. So this diet, to achieve those nutrients, it's high in fruit, vegetables, and also dairy products to have high calcium. So this is the difference, main difference between DASH diet and Mediterranean diet is the content of the dairy product. And the DASH diet also, a lot of studies been done, but most of those, like special randomized control trial that has a great effect on lower blood pressure. And blood pressure is important for cardiovascular disease because, as I mentioned, is the first step that cause the injury in the process of atherosclerosis. So protect the heart or the vessel if we keep low blood pressure. And also, then after studies, they show also effect of DASH diet in lowering blood cholesterol. Clear? The next dietary pattern is Canada's Food Guide. Actually, Canada's Food Guide, it's released in 2019 and recommend the regular consumption of healthy food choices to form a healthy dietary pattern, like many healthy food choices. It's like similar to Mediterranean, etc. They recommend fruit, vegetables, more plant-based protein, but actually we don't have information or data about if the effect of someone follow Canada's Food Guide and cardiovascular disease. So for that reason, in my PhD, we studied the relationship between a dietary pattern that aligned with Canada's Food Guide and cardiovascular disease. So to do that, how to measure if someone can follow Canada's Food Guide, first we developed something called Food Choices Assessment Score. Of course, this is not for like the exam, just for you to know what is going on. So we developed a Food Choices Assessment Score, and this Food Choices Assessment Score, or FCAS or FCAS, we studied the relationship among the national survey, so people in Canada, what they eat, relationship of different cardiometabolic risk factor. Cardiometabolic risk factor means blood glucose, blood cholesterol, etc. Those are the biomarker in the blood. And also in the third study, we saw the association with 10-year risk of cardiovascular disease. So what we saw, this is the Food Choice Assessment Score. It's ranged from 0 to 80 and contain like 9 components from fruit, vegetables, low red processed meat, etc. And we saw the results show what we did, like we divided individuals, or the Canadian, we divided Canadian into 5 groups from the lowest score, which means lower alignment with Canada's Food Guide, which is quintile 1, to the 5 groups, the healthiest, Q5, quintile 5, that they are having high score, which means they are following more Canada's Food Guide. So among these 5 groups, we compare those in the 5 to those in the 1, and we saw those in the 5, they associated with lower odds is type of statistical measure, lower odds of having elevated TC total cholesterol, non-HDL cholesterol, and LDL cholesterol, and many different results. I didn't show them here, like blood glucose, other different type of blood lipid and blood cholesterol. So it's good as a risk factor for cardiovascular disease. Also, we saw that those who eating, or those who having high score, which means they are eating healthy, like what Canada's Food Guide recommend, they have lower odds, about 55% lower odds of developing heart disease within 10 years. And also we saw that those group who has low score, they are not following Canada's Food Guide, they having heart age, mean biological age, that age that represent how their heart is as a risk of developing cardiovascular disease, is 2 years older than their actual age. And those in the high highest quantile of the score, which means they are having high score eating healthy, according to Canada's Food Guide, they have almost 3 years, their heart age is 3 years younger than their actual age. So here we can say that the benefits between Canada's Food Guide and cardiovascular disease, especially this data from Canadian population. Last things here I'm going to explain is the last dietary pattern called the portfolio dietary pattern. This diet is developed here at University of Toronto in the Nutritional Science Department by Dr. David Jenkins. And from the name portfolio, Dr. Jenkins, what he did, he collected different dietary pattern or different types of food groups that known to reduce blood cholesterol. So this diet contained nuts, because nuts is well known has polyunsaturated fatty acids, so decreased LDL cholesterol, plant protein, viscous fibers, and plant sterol. Those food, combine them together as a whole diet. And the early clinical trial that he did, they saw that they divided, or they have 3 groups of individuals. One of them control group, they are only recommended to eat low saturated fatty acid. And after 4 weeks of that, those group, they decrease the risk, or they decrease, the LDL level by 8.5%, while the portfolio diet decreased after 4 weeks of following portfolio diet, the LDL cholesterol decreased by almost 30%, which is very similar to the group who take medicine to decrease LDL cholesterol. So this diet, it's effective as the medication in lowering LDL cholesterol. And this is how they mentioned that this statement reflect that we don't have to follow the whole portfolio diet, even adding some food, healthier food from the portfolio diet, we see some benefits in reduction in cardiovascular disease. Any question? Okay. Hope we had a good lecture today. I really appreciate if you could help me to do the evaluation form. I don't know if the barcode between the slides you have maybe is now working. I updated yesterday. If you could help me to, this is because I'm early in my career, so to build a good reputation for teaching and having lecture. Thank you so much. And please, if you have any question, please let me know. In this lecture, in any lecture, or any things in nutrition in general. Good luck.